So before we begin, I just need to mention a few things. This webinar, the Herizen webinars, this one and webinars moving forward, they are a space to provide education and empowerment, and it is not possible to discuss individual cases. That's right, Sumi, isn't it?
Yeah.
And
Absolutely.
you are not affiliated with any pharmaceuticals and you're non-sponsored. Therefore, you offer tailored evidence-based care to your patients. I would like to, if I may, Sumi, by starting to tell our community a little bit more about you, if that's okay. I feel like I'm talking about you when you're here.
Thank you.
But you are a dedicated GP with over 20 years experience. You don't look old enough for a start. That's
Oh, come on. You're always giving me too many compliments. I put extra moisturizer on tonight.
Absolutely. You look amazing. You've got a passion for continuous learning. You strive to offer evidence-based care to your patients. Lucky them. I wish you were my doctor. You're also, which I think is just incredible, especially for Herizen, you're accredited by the British Menopause Society, and you support women currently who are going through perimenopause and menopause and life beyond, I suppose.
Yeah. Yeah.
And that's all through the NHS, right? All through the NHS. Amazing. But what is super exciting is, and as if you have enough time to do this as well, I don't understand, but you also founded Dr. Sumi London, which is your private clinic.
Yes.
Where you empower women to feel seen, supported and strong both on the inside and out, which is incredible. And I know this for a fact, but you are known for your warmth and care, and you're committed to making a positive impact in your patients' lives, which is just incredibly important as a doctor, I suppose.
Absolutely. And it's at the core of what I do. I mean, I love what I do, and it's because of that I can enjoy what I do. So no, honestly, thank you so much. That's such a lovely bio that you've just given off me. So thank you for saying those words.
Honestly, so well deserved, Sumi. Absolutely. So this is our first webinar, and we are starting with menopause back to basics. But I know that you were coming at it slightly differently, and you wanted to title it, and rightly so, The Wonders of Womanhood.
That's right.
And
because we are a wonderful species, and I think we need to honour that.
Yeah, absolutely. So now I'm going to stop talking and I'm going to hand over to you. Just for our community, before I do stop talking, if you do have any questions that come up, just pop them in the chat box and we will do our best to get through them. Is that right, Sumi?
Perfect. Absolutely.
Amazing.
Perfect.
So let's get started. I can sit back now and learn. This is amazing.
Well, thank you very much for handing over the mic to me. And, thank you so much, Cassie, for, as I said, for the really kind introduction. And I'm so excited to be in this space with you all today. And I'm also really excited to be one of the first to be starting these expert webinars off. Honoured, excited, a bit nervous, but as you rightly said, I just wanted to strip things right back to basics and discuss the wonders of womanhood, because women are truly, truly incredible. And I think the female body is powerful and fascinating, but at the same time, we go through so many hormonal changes through the different stages of our lives that it can be so overwhelming and also challenges our resilience. And that's why I think Herizen gives us this opportunity to learn and support one another as a tribe. And as you've said, and many others have said, when women support women, wonderful things truly happen. So my main aim really is to provide information that helps us understand what's really happening beneath the surface and share knowledge to empower you to take control of your health. And I wanted to start at the beginning, as I think it really helps to understand the purposes of the hormonal changes, but also helps us to share knowledge with our children, nieces, nephews, family and friends. And I'm fascinated by the power of the female body. And as I've said it before, and I'll keep saying it again, the female body is truly amazing. And at birth, a girl is born with her lifetime supply of eggs, which we medically call oocytes. And these gradually decline with age. And from birth, these early stage eggs stay in that early stage until puberty. And the average age for the first period is usually around 12 to 13 years old. So you're having and experiencing these changes at such a young age.
Yeah.
And the main job of the menstrual cycle is to help an egg grow and be released from the ovary, but at the same time, the lining of the womb gets ready for a fertilized egg to attach. And if no fertilization happens, the lining breaks down, leading to a bleed, and that's the cycle. And we just repeat that cycle again and again. And the menstrual cycle is controlled by signals from the brain and the eggs. And many of you will be familiar with the hormones that I'm going to mention as part of your menopausal journey. So in the brain, there's a hormone called follicle stimulating hormone, FSH, which is released, as well as luteinizing hormone, which is known as LH. And the eggs release estrogen, and following ovulation, progesterone is released. And it's these hormones that communicate with the brain to change the signal of FSH and LH. And things like stress or illness can affect these signals and change the cycle pattern and length. And it's this communication between the hormones which is vital for cyclical changes, supporting fertility and pregnancy, and then the menopausal transition. So now that I've taken you back to your school biology lessons, I'm not sure if any of that you remember that from your biology lessons, but I thought it was really important just to set a scene of why do we have these hormonal changes.
Yeah.
And, I'd love to hear of your thoughts about, does that, do you recall it from your lessons at school, and if you found that helpful? But I also wanted to spend a bit of time talking about hormones in general. I often get asked about the function of hormones from many of the women that I see, so I thought it might be helpful to briefly discuss those today as well. So what's estrogen? Well, estrogen is one of the main female sex hormones. It's actually a steroid hormone which originates from cholesterol. Funnily enough, and I don't think many people know this, but cholesterol goes through a series of reactions and conversions to become an estrogen. And estrogen plays a critical role in the development of female sex characteristics, the regulation of the menstrual cycle, and it's important for fertility and pregnancy, as well as the maintenance of bone health, cardiovascular function, and skin elasticity. And if you think of estrogen as a family of hormones, estradiol is the most prominent member of that family. And maybe many of you might have heard of estradiol being mentioned, because actually that's the most potent and active form of estrogen, and especially during the reproductive and perimenopausal stages. It's crucial for reproductive tissue development and promotes development of breast tissue. And it also is important to increase bone and cartilage density. It's made by the ovaries predominantly, but also smaller amounts are made by fat tissue, the brain, and the walls of the blood vessels. And at its highest levels, it reaches at ovulation, which is around days 12 to 14 of a 28-day cycle, and at its lowest at menstruation, so days 1 to 5 of a cycle. And this is important because if you've ever had any blood tests done, often your doctor will say that you need to do certain hormones at a particular time in your cycle. Estradiol is also the most commonly present hormone within HRT. Now, moving on to progesterone. So what's that important for? Well, it influences the regularity of a menstrual cycle. It's key for maintaining pregnancies, and it's not often spoken about, but the natural levels of progesterone actually drop before estrogen starts to change. And it's this early decline which can lead to the irregular or heavy periods, mood swings or anxiety, trouble sleeping, as well as breast tenderness and fluid retention. Because these symptoms are often the first to occur, they can alert us to an impending menopause transition. And later on, the estrogen levels start fluctuating and eventually decline, leading to a more familiar menopause symptoms like hot flushes, vaginal dryness, and night sweats. And I think the last hormone that I just wanted to mention is in relation to testosterone. So that's produced by our adrenal glands and ovaries. And in females, it's known for influencing libido. So it's really important, especially in terms of the level of interest in sex and the amount of pleasure felt from it. And the levels do decrease with age. However, we still need more studies to understand the benefits of testosterone therapy for cognition, mood, energy, and musculoskeletal health. So understanding all of these hormonal changes for individuals is crucial for managing symptoms of the menopause effectively. It allows women to implement lifestyle changes and seek appropriate treatments to elevate the discomfort associated with this transitional phase. So I hope that gives a bit of an overview about the hormones, because as I said, I do get asked often about those, and I'm more than happy to, answer any further questions that you may have. But I wanted to also talk about the menopause definitions, if that's okay, because many women are familiar with the definitions, but actually some of our Herizen community may be at the start of their journey. And I'm thinking specifically our gentle initiators, that they may not be fully familiar with the definitions themselves. So what is the menopause? Well, it's actually defined as the permanent end of the menstrual cycles, hence why I wanted to talk about the menstrual cycle in the beginning. And it's caused by a fall in the number of mature eggs that the ovaries have. So essentially, the ovaries switch off. And it is what we call a retrospective diagnosis, which means it is diagnosed a year after the last period. And the average age at which the menopause occurs in the UK is approximately around the age of 51. However, 1% of women become menopausal under the age of 40 and 0.1% under the age of 30. And there are different types of menopause. There's premature ovarian insufficiency, and in my NHS clinic, I sadly see women from the age of 25 to 40 with premature ovarian failure, and it has a really huge impact on a woman's life. There's also early menopause, which is classified under the age of 45, and then there's surgical and medically induced menopause, which unfortunately is an abrupt drop in your hormones as a result of surgical or medical intervention. Perimenopause is the start of symptoms until you reach the menopause. And this is the start of the ovaries essentially becoming a bit wonky. Therefore, the ovaries fluctuate in function, leading to changing and confusing symptoms that can come and go. And then eventually the estrogen levels decrease steadily, which can lead to the common symptoms that many will be familiar with. And as I mentioned earlier, the levels of progesterone become highly unpredictable, leading to changes in menstrual patterns, and women may experience heavier, lighter, or more irregular periods as a result of these fluctuations. And it's this inconsistency that can complicate conception efforts as well as contribute to mood swings. Now, the perimenopause phase can be as long as 10 years, but on average, it's about 7.5 years long. And then finally, you have the postmenopausal phase. And this is the stage after the menopause. And actually, over 35%, a third of a woman's life is now spent postmenopausally. So it's so important that we protect a woman's health, as the quality of life is incredibly crucial to this group of women. And worldwide, it's predicted that in 2030, there will be 1.2 billion women who will be either menopausal or postmenopausal. So this has a huge impact for women and society. And although definitions are helpful, but often the wrong terminology is used or it can be confused. And what we should really be interested in, and what I'm really interested in, is the whole hormonal change before and after the menopause transition. And this is the most challenging time for women because, as I said, it can creep up on you and it can be incredibly confusing to understand, as many of you have already shared on the Herizen groups. And I would really encourage you all to keep sharing your experiences on the app, and also please share within the comments section today as well if you feel comfortable. But please also, do ask questions, because I'm talking through a great deal of information, and I'd love to hear your thoughts and any queries that you have. So, I've spent a bit of time talking about the menopause transition, but I'd also like to talk about the symptoms. And at this point, if there are any symptoms you feel you're comfortable to share, or the challenges you've faced. I think that'd be really helpful, Cassie, if there are any
Yeah,
comments
absolutely.
from individuals there. But
Yeah.
I'll just carry on if there aren't any comments
Nothing
at
at
the
the moment.
moment.
No.
Okay. So in terms of the symptoms of the menopausal transition, a woman's body undergoes various hormonal changes, and they may experience a variety of symptoms that can affect their physical and emotional well-being. And many of you will be familiar with the common symptoms, but there's actually an enormous number of symptoms. However, not every woman will have all of these, and they'll have their own personal experiences. Most of the cells of our body are enriched with estrogen receptors. This is why the experience can be so different, as well as so vast in the number of symptoms. So the estrogen receptors are there to be able to respond to estrogen and allow it to change the function of the cells, whether it's a skin cell, whether it's a bladder cell, any cell of any organ, you'll find estrogen receptors there. And what this means is that if you've got one organ of the body that for some reason or another is struggling with its function, then this menopausal transition, taking away the estrogen, might actually be the last straw. So recognizing and understanding these symptoms results in supportive and effective management. So some of the symptoms that I commonly hear about, and I've mentioned one or two already, is changes in your periods, which is mainly due to the progesterone, as I mentioned. Hot flushes, also known as vasomotor symptoms, and one of the most commonly reported symptoms. And hot flushes involve sudden, intense feelings of heat that typically affect the face, neck, and chest. And these sensations can result in sweating and discomfort, disrupting daily activities or quality of life, as well as impacting on sleep. And as some of the members have already commented in the app itself, being drenched overnight as a result of all the sweats. It is slightly more common in smokers and those that have got a BMI over 25. But there's also some really exciting news. There are medications in development which aren't hormonal, and they actually work on a brain hormone to inhibit it and stop the flushes. And I think this is going to be a real game changer for any of those women that can't have HRT. So it is a medication that's in development at the moment, and hopefully in the coming year we will have that available.
Amazing.
I think, given that that's one of the most common symptoms, we really need to have effective treatments to help and support women. Other things, and this is one that disturbs me quite a bit, is the sleep disturbances. So when estrogen levels are lower, your sleep is in the lighter phase and you're more likely to wake up more easily as well. In addition, because your progesterone levels are dropping, the relaxing and sedative effect is reduced, making it harder to fall asleep or stay asleep. And then you've got the turn of having increased anxiety and restlessness. There's also tiredness, irritability, poor concentration, and just feeling constantly drained, which so many women do tell me that they're experiencing, as well as mood swings, panic attacks, and feeling more emotional, similar to what happens after having a baby. And there's that hormonal roller coaster that we feel at that time, where you're just feeling tearful all the time and just upset for no reason at all. The cognitive side of things is also a big symptom that we often feel and see. So you've got brain fog, difficulty making decisions, difficulty focusing on complex issues, as well as memory impairment as well. We know that there's a specific area in the brain, which is called the hippocampus, and it's changing its function at the time of the menopause. And this area is stuffed with estrogen receptors. So this part of the brain is responsible for taking information and putting it into our memory, so our hard drive. But it's recalling this information that seems to work less well, and that's why recall is often very difficult and delayed. So it's not a true memory loss where you don't recognize the fact, it's actually a recall issue. But it can lead to such difficulties in your day-to-day functioning, as well as your ability to work as well. Skin changes is another common symptom that I hear. And as the largest organ of our body, there are estrogen receptors present in various skin cells, which play a crucial role in maintaining skin health, structure, and appearance. Therefore, as the estrogen declines, women feel their skin has changed and feel the effects of aging. And this is an area that I'm really keen to share more information with you all in the future, if you all feel that's of interest to you. Other things that I hear about, and often women are experiencing, is weight gain, headaches, palpitations, joint pain and stiffness, low confidence and self-esteem, difficulty coping with work, family, relationships, which lead to many reducing or changing their social dynamics. And then there's a slightly strange one, which some of you may have heard of. It's called formication. It's a strange feeling that you get, like little ants are crawling under your skin. It's a horrible sensation, but actually many women do experience it, but don't always connect this with the menopause transition itself. The other area which is affected is vaginal and bladder symptoms. And again, many women are embarrassed to talk about these. And I think it's really, really important that we provide a supportive environment and open conversations for women to feel comfortable to express these type of symptoms. But at the same time, I also understand that unfortunately, when women do tell medical health professionals about these symptoms, they're still very often undertreated. And in actual fact, most women can be treated for these issues with just local estrogen. This is safe for a large majority of women, including those women who are on tamoxifen. So there's no reason at all that if somebody is suffering, that they shouldn't be able to seek some sort of treatment for it. So due to the decreasing estrogen levels, there are changes in the vaginal walls, which lead to thinning and drying of the area, leading to a reduction in sensation, elasticity of the vagina, and in lubrication as well. There are also bacterial changes, so the normal environment of the vagina changes and the normal protective bacteria is lost. And all of these changes lead to reduced sex drive, painful intercourse, vaginal and vulval irritation, as well as vaginal dryness. And again, this is an area which women just don't seem to express, but they do find it easier to express if they feel they're in a supportive environment. There's also a high number of estrogen receptors in the part of the bladder, which tells you when you need to empty your bladder, as well as in the bladder muscles and the bladder valve muscles. Therefore, a lack of estrogen can give you symptoms that are very similar to a UTI, a urinary tract infection. So you might have a burning sensation when you pass urine. You might be needing to go more often and more urgently. You might be waking up at night more so. And also you may get the start of incontinence for the first time due to the hormonal changes, as well as the changes in the pelvic floor. And these genitourinary symptoms of menopause are really underreported and often incorrectly treated as recurrent UTIs. And I see this too often. Therefore, if you're experiencing any of these symptoms, it is really worth seeking medical review to understand the cause and not just have repeated treatments for a potential UTI. The other area that sees change is the pelvic floor. So type 2 collagen provides the strength for the pelvic floor. And with estrogen deficiency, this changes the type of collagen, thus reducing the strength of the pelvic floor, so it becomes more easily stretched and it can lead to prolapse, especially in women who've had children. So I know I've listed a huge amount of different symptoms and there's many more that I could talk about, but I wanted to really share some key ones that I'm seeing in clinic and also make you more aware of the type of symptoms that you should be aware of as well as thinking about postmenopausally, the long-term health implications for women, and that we use these opportunities to discuss and reduce the risk of osteoporosis, because a woman can lose up to 20% of her bone density within the 5 to 7 years around the menopause, which is incredible. Also reduce the risk of cardiovascular disease, because the decline in estrogen can lead to weight gain, as I mentioned earlier, but it can also increase your bad cholesterol, the LDL, and increase arterial fat in the blood vessels, which poses all an increased risk for cardiovascular disease. There's also some belief that menopause may contribute to the increased risk of dementia. And many of these symptoms can be have debilitating effects. And I'm aware I've gone through them, as I said, very quickly, but I'm more than happy to focus on specific areas that are of interest to the Herizen community. I'm just going to take a little pause there and see if there's any comments or anything that you'd like to pick up, Cassie, before I move on to the next parts.
I can only imagine that our community are sitting at home nodding like I was when you were going through each of those symptoms. And it's just utterly incredible that something so natural can have that effect on our body. You know, it really feels
Absolutely.
like a time where you want to remain as positive as you can and embrace this time of life, but actually it's really quite challenging.
Absolutely. And I think that's the key. And if you're unaware of, the vastness of the symptoms, sometimes putting two and two together, it's like I said, it creeps up on you. You're not quite sure what's happening to your body. You just don't feel like yourself. So I just hope that this information helps initially to be able to think about those things and think about how much it does impact. And whether it's yourself or your family members, just understanding how menopause does, this transition, how much it impacts a woman's overall health and well-being.
Yeah, absolutely. Sumi, is a hot flush the same as a night sweat?
So they're slightly different, but essentially it is a vasomotor symptom that's happening. So it's causing your body to excessively sweat. So both are starting from the same baseline, but they may be triggered for a different number of reasons. Some women only get hot flushes during the day and no night sweats at all, and others get a bit of both, but they do originate physiologically from the same cause. And actually, treatments are fairly similar for both of them as well, as long as it's not any other cause that's causing these symptoms. And that's what I think that's what's really important to know, that sometimes we can also think that this is all related to their menopause, and actually there may be something else going on that we really need to ensure we have ruled out before saying that this is all just part of the menopause as well.
Yeah, but it's really good to hear that the future looks more positive in terms of being able to manage those, because I know from most of the people that I speak to, most of the women that I speak to, hot flushes are right up there at the top, and they're unbearable. They're embarrassing. You can feel really aware of them. The more you're aware of them, the redder you go. They can happen at any time. So
and that's the thing. And the thing is, women who can have HRT, I mean, they work really well. So hormone replacement therapy works really well for vasomotor symptoms. But for those that can't have HRT for the numerous other, clinical reasons, there are alternatives. Obviously, these are drugs which are also used in other conditions, but they can work, but it is sometimes a bit of trial and error. However, if we can develop, and this particular medication I was speaking about earlier on, once that comes in, for us to be able to prescribe, it will be a game changer, because it's working directly on, a specific enzyme within the brain. So, it's a transmitter there that may well help to stop these horrible, debilitating hot flushes where women have got no other alternative, where they can't have HRT. So, no, absolutely agree. And over the last, 10 years, we've made masses of progress, haven't we, with menopause care, as well as the development of medications, but there's still a great deal more that needs to be done to provide women with the best quality of life and outcomes for their longer term health. Because, when I mentioned a third of a woman's life is spent postmenopausally, that's a huge amount.
Yeah,
1.2 billion women worldwide are expected to be in that phase in 2030. So it has incredible impact overall. It really does.
yeah,
So
absolutely.
if it's okay, I might just carry on, because I'm just mindful of the time. So I just want to quickly go through diagnosis. So I think I briefly mentioned that diagnosis is usually based on symptoms. So it's understanding the history of symptoms, the period patterns, as well as assessing overall health. However, for younger women, we may consider blood tests for diagnosis, but also check for other causes, as I mentioned earlier. However, but usually we don't do regular blood testing, as it's not routinely required or recommended, but each individual is their own, we have to take each case by case to decide whether it's appropriate to conduct any further blood testing. I also wanted to briefly touch upon the lifestyle adjustments for managing symptoms. So although I'm aware that we've got some great expert lives coming up on the horizon that will be going into these in a bit more detail, I just felt that it would be useful for me to share some of the things that I discuss with my patients on a regular basis, because they can significantly enhance your ability to manage symptoms during this transition. So let's talk about diet. Nutrition plays a vital role in how our body copes with the changes during the transition, and I think many of us are aware of this. It's essential to focus on balanced meals that are rich in essential nutrients, and increasing your intake of calcium and vitamin D is particularly important, as they're vital for bone health and, as I said earlier, in relation to reducing your risk of osteoporosis. So I do recommend that most women I see should consider taking vitamin D, at least 10 micrograms a day, or 400 international units. I also tend to discuss dietary intake of protein, because there is an increased need for a woman in the menopausal transition to have at least 1 to 1.5 grams per kilogram body weight per day, as well as consider having at least 30 grams of fiber a day, because this actually reduces the risk of cardiovascular events, diabetes, and colorectal cancer. So your fiber intake is incredibly important. And obviously things like having foods in your diet that include dairy products, green leafy vegetables, fish, they're all excellent sources of nutrients as well. The other thing that I often speak about is exercise. So engaging in regular physical activity is another powerful way to manage symptoms. Exercise not only helps in maintaining a healthy weight, but it also improves mood and sleep quality, both of which can be negatively impacted during this stage. And weight-bearing activities are crucial, but activities such as walking, swimming, or cycling for at least 30 minutes a day can offer significant health benefits too. And I think finally, I just want to talk about stress management. As a woman, our lives are full of stress due to the multiple hats we have to wear. And the menopause transition can also bring about emotional fluctuations that may enhance stress levels. So adopting stress management techniques such as yoga, meditation, or even deep breathing exercises can be extremely beneficial. And I would really urge our Herizen members to make use of all the resources available on the app to help with this, because these practices not only help in reducing stress, but also contribute to overall emotional well-being and relaxation. And by integrating these lifestyle changes, you can better manage the symptoms of menopause transition and improve your overall health and well-being during this phase of life. But for some women, the simple lifestyle adjustments aren't enough to effectively manage the often uncomfortable symptoms associated with this transition. And when these initial efforts prove insufficient, I then speak about medical interventions which may become necessary to provide relief and improve quality of life. So among the most common and effective treatments, as I mentioned earlier, is hormone replacement therapy. And this therapy works by stabilizing the fluctuating hormone levels, thereby alleviating many of the associated symptoms. And it's really important for women considering HRT to consult with their healthcare professionals to understand the potential benefits and risks associated with this treatment. But there's also many non-hormonal options available as well. And I'm more than happy to discuss any of these in more detail in the future if that's what's felt appropriate by our members. So now, menopause transition is such a vast topic, and there is so much I could keep talking about, and I would love to share more. But I also appreciate that I've just touched the surface of some aspects. However, I was just mindful that I didn't want to take over your whole evening with my passion to share knowledge. And this is only the start of the conversation on Herizen, and there's much more to come from me in the future. So for those of you that haven't been able to join the live and watch later, I wanted to keep it short enough to be able to fit into your day-to-day life. But I'm also really, really happy for you to message any of your questions that you may have. So I'm just coming towards the end of my live. And my goodness, I don't think I've spoken this much in the past. I'm so used to, and I was saying this to you earlier, wasn't I, Cassie? I'm so used to having an interactive conversation, or at least having slides or something. And I spend most of my time listening to patients. So hearing my own voice for so long is really not usual for me. But I really hope you've all found it informative, and you can feel empowered to make choices and seek support and reclaim your health. Understanding and managing these changes is key to maintaining a good quality of life during this period, but also to protect our future health. And I hope we can embrace this change, knowing that there is support to help us navigate and learn so that we can approach this new stage of life with a greater ease and confidence, ensuring smooth transition through the stages of hormonal change. As I said before, a woman's body is wonderful, but it also tests us. Let's give ourselves and those around us the love and support we need and deserve. Thank you again for taking the time this evening, and I'm sure we've got some time for questions, but I'm also happy if you want to take some time to reflect and contact me separately, then more than happy to answer your questions at a later time. And also, I did mention that there will be some future lives, and I'd love to hear from you as a community about which particular areas you'd like me to focus on. So I think I might take a pause there, Cassie, if that's all right. I might take a sip of water now.
Have some water, Sumi. Absolutely unbelievable, that information. And do you know what I loved about it the most? I understood it, which was what I needed. And that's where I feel like I was lacking when I went searching for my information about the menopause and how I could support myself. So thank you so much for explaining that in the manner that you did. It was so interesting. I'm not sure, bear in mind, community, that this is our first webinar. I'm not sure whether or not, I just can't see the comments, or if there are no comments, but there isn't anything at the moment. However,
it shocked everyone.
Yeah, it will be saved in our Glow community within the Glow Lounge. So, ladies, if there are any questions that you want to ask that for whatever reason I can't see right now, so apologies for that. If you just pop them in there, then Dr. Sumi will be able to answer them and feed back to you. But this is just all about us creating that safe space and making sure that you feel that you can ask those questions. So if now is not the right time, that's okay as well.
Absolutely.
Sumi, one thing I did want to touch on before we go, I know that in Dr. Sumi London, your private clinic, you offer wellbeing reviews. Can you talk us through a little bit about that?
Yeah, no, of course. So I offer a women's wellbeing review, which is essentially an in-depth consultation, and it's usually about an hour long, either virtually or face-to-face. And it's based on the principles of listening and understanding exactly your needs and thinking about, what are your current symptoms that you're experiencing? How do you want to be able to navigate your health? What are you struggling with? What is the evidence-based information that is suitable for you to make the right plan for you, but also perhaps think of skin health and those type of things. So it's a very holistic opportunity to have a discussion about your health needs, focusing specifically on women.
That's incredible. And is that available to women that are in a natural menopause and also women that are in a medically induced menopause?
Absolutely, because I think, each individual you've got your own different concerns and health needs. So it's an opportunity just to have a really in-depth consultation, as I mentioned, for you, as in the person there, to discover what is it that they need and actually how best to navigate their health, whether it's via the NHS or whether it's privately. But sometimes just having that information which is specific to you can help to open up possibilities that you may not have thought about.
Yeah, it's absolutely brilliant. I don't believe that there are any comments right now, Sumi, but again, this may be technology that is preventing me from seeing any, but I can't see anything at the moment. I wanted to say a massive thank you to you for joining us tonight on our first Herizen webinar. It's incredible and exactly what our community need. And moving forward, our community, Sumi will be coming back on the 27th of January. And we will then go almost like a bit more of a deep dive, but we're going to find out what you want that to look more like, and whatever that looks like, we will then endeavour to deliver. Is that right, Sir?
That's perfect, because as I said earlier, given that this was the first one, I wanted to give an overview, enough information, but not go into too much depth, because it's actually, I'm going to be guided by our community, as in what you need. Everyone is at different stages. Everyone's got different questions. I'm here to provide you with the support and knowledge that I can, and help direct wherever I can. And if sometimes I miss any questions on the app itself, please just put my, the @ and tag me, so then it actually alerts me of the notifications. But I'm more than happy to support all of our community going forward. And I hope it's been helpful.
Amazing. Thank you so much. And thank you to everybody that has joined tonight. We really hope that you found this beneficial. You can watch this back. There was a lot of information there. So you can watch it back. You can replay. It's there for you. It's at your disposal, and it's within the Glow Lounge on the Herizen app. So thank you so much for joining. And Sumi, thank you so much for your time.
Thank you so much for having me. Have a lovely evening, everyone.
Speak to you all soon. Bye.
Bye. Bye.
It's your thing.